Let's have an eagle's eye view of basic sleep issues. Let's categorize sleep issues for easy understanding. So we can differentiate things into what happens during sleep, what happens when we are awake, things which happen during light sleep and excessive sleep. So these are the categories that we are going to look at. So number one, excessive daytime sleepiness. That's one of the most common issues that we come for consultation. So while driving, you just suddenly sleep off. Or while the extreme effort is that while speaking to someone important, suddenly you sleep off. Or when supposedly you are supposed to have a happy emotion, you are suddenly sleeping off. The other one is what happens during sleep. So difficulty in falling asleep. You go to bed at 9 o'clock, but till 1 o'clock you don't get sleep. The other one, you sleep well. Initially, you fall asleep easily, but then you wake up at around 1 o'clock and then you don't get sleep at all. Then what happens during light sleep, that is REM sleep? REM sleep is the brain is almost active. The EEG studies have shown that brain is almost active as we are awake. So it's something like, but you're not aware of surroundings. So it's something like an offline event. Something is happening over there. So during this period, we see a lot of dreams. So dreams are normal, but at times it can be excessive. It can lead to night terrors. Then there is something called REM sleep behavioral disorder, where we tend to act out our dreams. People speak during that time while doing all sort of actions. Then comes periodic limb movement disorders. That means a normal movement as awakening during sleep, during which the movements are normal. But when these are excessive, it starts disturbing sleep. So it's called periodic limb movement disorder. Then there is something called restless leg syndrome, where we tend to move our leg. If you don't move, you feel that uneasiness and your sleep can be disturbed. The other one is sleep disordered breathing. There are two types, obstructive sleep apnea and central sleep apnea. It can be easily found by doing a polysomnography test. The importance is that OSA can lead to a lot of other diseases like stroke, heart attacks, diabetes, hypertension, stress, multiple disorders. So it's very important to evaluate when someone snores excessively. And the last one is hypersomnias, where people tend to sleep more. It can be due to lesions in an area called hypothalamus, or certain people, even if they sleep for 9-10 hours, they don't feel restful. It's maybe their normal sleep pattern too. So what should we do? At Apollo Vanagaram, we did a series of research and then found that sleep encompasses multiple specialties. So we formed a board of specialties where each patient will be evaluated by the board of specialties, which encompasses neurologists, ENT surgeons, and pulmonologists. So we as a team are able to give our patients a better balance in life by giving them the opportunity to look the sleep health as a holistic aspect in their life. So if you have to improve your sleep health, please connect with us. Thank you.